Well, he's an old shepherd doing what he can, trying to make a living just raising sheep and lamb. Normally, when a lamb is born, it gets up and starts eating by itself. Sometimes the shepherd has to intervene if for some reason it doesn't get something to eat. It is very important that a lamb gets something to eat very early in its life. Sometimes, if it does not have a suckling reflex and won't suckle from a bottle, sometimes we have to tube it and actually put milk right into its stomach. This is pretty easy to do, but there is a precaution. You need to make sure that it goes in the stomach and not in the lungs. So let's take a look at how to do that. Before you tube the lamb, obviously you have to have something to give it. So usually you express some milk out of the mother in a small jar and pull it into a syringe. Sometimes if a ewe has a lot of milk, you can save some and freeze it in a freezer. But you need some milk. Usually 20, 30 or 40 cc's is enough to get the lamb started. And usually all it takes is a little milk and it comes right around and gets up and starts nursing on its own. The only precaution that you need, if you find the lamb and it's cold, do not tube it and put milk in it, because it has to be warmed up or the milk will not be absorbed into the system. With the lamb lying down, take the tube and measure from its stomach, which is about here, to its mouth. So it's going to take about this much of the tube to go into the stomach. If it will only go in about half that distance, it means that the tube has gone into the lungs. In that case, pull it out and try to get it in again. Now I naturally try to use the curve of the tube to match the curve of the throat. It usually goes in easier that way. First, lubricate the tube with some milk. And then gently work the tube right down the throat. If it feels like there's an obstruction and it's not going, don't force it. Pull it out and start over again. Okay, it's gone into approximately where we thought it was. Slowly push out the milk. Into the stomach, and when it's all in, just slowly pull out the tube. That's all there is to it.